Let's restart that. What's up, guys? My name is Dr. Tan, and today we are talking about first aid kits. This is my 2024 update, and we are talking about what should be in your person, what should be in your base camp kit, what should be on your multi-day expedition kit, and what should be on a weekend expedition type of deal. So, if you are someone who goes into the backcountry, goes on these camping trips, or if you're just someone who just likes being prepared, whether it's on your way to work in your vehicle, whether it's going to a concert, or whether it's having a first aid kit that's reliable and has the right stuff at home. This video is for you. So, for our students who are popping by, I see Brian. What's up, everyone? Thank you for showing up. And we're going to jump on in because, for those of you who don't know, I just got back from Alaska, which has been such, number one, an adventure, but number two, such a scary experience in two different ways. Number one, we had grizzlies out there, we had wolves out there, we had all these other things. And this was an expedition that was unguided, and it was an unguided hunt. It was past Gray Mountains, really in the wilderness with not a really good definitive way for rescue. So this was us taking a break after a hike up, and man, it was such a hike up in the tundra. For those of you who have hiked in the tundra, there's basically these boot-sized potholes every single step that you take. The ground's uneven and it's really hard to walk. So we're going to be talking about the common things that you can expect for injuries in environments like that, but in general as well, because common injuries are common. And in addition to that, you'll see exactly what I brought, because this is the kit that I literally just pulled out of my rucksack that came with me on this adventure. Some of the stuff that we actually used, I'll describe, but I think I have extras to show you everything that's here. So let me know if you have first aid kits in the comments. Let me know where it is and bring it on over here, because we are going to update a few things. Prior to me leaving, I looked at like a already commercially available first aid kit, and I got rid of, I would say, 60 to 70% of it. So it goes to show you that there are some things that you don't need, and some things that you definitely need. So just to go through some of the things succinctly, I just had some reminders of what we're going to review today. So number one, the first aid kits, both individual, base camp, weekend. And I would say the individual one, think about this is the type of stuff that you would bring, let's say, on a day hike. And maybe if you're just going to the grocery store, this is what I would bring to concerts and that type of thing if I was just walking around in my hometown. And base camp, if you're not in base camp, if you're not on a multi-day expedition, this is the kit that I would typically keep at home. So this is my home base camp. Weekend first aid kits, that would be something that I would take on a weekend camping trip or a overnighter. And in addition to that, that's what I would keep in my truck or car. So we'll also be touching base a little bit on medications, because I did bring several prescription and non-prescription medications. I brought some antibiotics as well. And we're going to talk about some diagnostic tools, even for people who may not have a whole lot of medical training, and some safety and signaling things, and some creature comforts that I definitely appreciate. So before we get into what I brought, some of the things to keep in mind is you want to bring things that, number one, could save your life when you know that evacuation is probably going to take more than 15 minutes. And if you're in the middle of the city, if you are in a suburban area, you can expect an EMS, fire station to respond to you, a police station to respond to you within a few minutes. However, let's say if there was an event, let's say if there was something where traffic or accessibility or just volume of injured people is an issue, you're going to want to have things on hand, on your person or in your vehicle, so that you can address that thing. What's up, Ryan? So we are also going to be talking about the emergencies. And if you are not a student right now and you're tuning in to just get a flavor of what we talk about, check out our free 7-day trial right now. We have a promotion going on at www.survivenow.online/lifeline. I'll put that in the descriptions. But the emergencies that you want to make sure you have the stuff for is bleeding, because that could kill you within minutes. anaphylaxis, or severe allergies, if you or your loved ones or your travel buddy has known allergic reactions, airway compromise. So this is a mix of things that you can bring and a mix of maneuvers that you can do. So if you don't have the things, you can get the things, but if you don't know how to use it, I highly suggest that you do our trial, and we have our lesson up for review, so you can join for free, watch it for free, and then if you want to learn more, just stay on. Breathing problems. We talked a little bit before about what we can do to optimize our breathing, especially the place that we went was a little bit of an altitude, especially for our flatlanders over here. And in addition to that, on the same vein, altitude sickness, heart attacks, because I was traveling with my wife's uncle, who's honestly anyone who's, I think the youngest I've seen this year was 26, and they had a heart attack at 26. So I'm just saying, if you're an adult and you have chest pain, you need to know how to identify that for your buddy, for yourself, and know what you can do medication wise to temporize that syndrome. And the hypothermia is going to be a big, big one. I want all of you to modify what you bring into the field, because hypothermia is definitely something that you can prevent. And then major fractures, dislocations, head and spinal injuries. You have some maneuvers that you can do to help stabilize things, some materials that I would recommend, but education is key here. So with that, that's some of the emergency stuff. We'll talk about a little bit of the boo-boo stuff as we're going over the kit. But let me show you what I brought. So I was responsible for this once in a lifetime hunt for my uncle-in-law, Larry, and I really wanted to make that environment as safe as possible. So I brought this big guy. So this is a brick. This is from Duration Health, and they typically prescribe and give you antibiotics and a bunch of different medications. And I do recommend this for the adventurer. I do have another company that I will promote as well, because both of them are really good, especially for our Canadians. So stay tuned. I'm going to give you some information about this. But not every prescription drug that they give you isn't 100% necessary. So do you need antibiotics all the time? I would say for certain things that is going to ruin your trip or make it miserable, and we'll talk about that in a little bit, sure, bring it. But it is extra volume, it is extra weight. So I was very selective with the prescription medications that I brought. So let's take a look at some of the things that I would bring. So this pack, on the front end, I have like boo-boo stuff. So I got rid of all my band-aids. In my opinion, you shouldn't need band-aids, because there are other bandages, other materials that you can bring that are just way more robust. So over here, you'll see that on the inside of the pack, it has these organizational bungees, which are nice and helpful. And you can see there's a little bit of blood in this little swab over there. But just to go down the line, wound care is going to be a very, very common thing, especially for you outdoors people getting into outdoor activities. It's one of the first things to happen, that and burns. So for our boo-boos, cuts, wounds, splinters, burns, things that I would bring for cuts and wounds. Number one is not all wounds need antibiotic or antibiotic ointment even. So I just have a little bit of Vaseline. And the reason why I duct tape it is this is actually not in this main kit. This is on my personal kit. And I'll show you. My personal kit is on this chest rig. So this is my bino harness from Eberly Stock. Highly, highly recommend. Lightweight, has Molly on the back if you want to add additional stuff. But I have my bear spray. I have a storm whistle around my neck. And I have my Garmin that was inside of this. And my binos are in there, and some emergency stuff are in there too. So we'll talk about the individual first aid kit when we get to that section. And you can see I do have some trauma shears there in the back. So this over here was wounds are so common, and sunburns, irritations, gear that have any kind of moving part or piston, and fire starting is really, really common for a problem. So I keep this on either my person or in my backpack that I'm carrying. And I duct taped it because if it's hot, and Alaska waxes and wanes in temperature, it was hot the first day, then snowed the morning next. So I just wanted to make sure that that was sealed. So for wounds, I would carry this. So if you don't have something like this in your first aid kit, this I would take 100% over any Band-Aid and any kind of alcohol swab, because wound cleaning under pressure is just so much more effective, and it's a reusable resource, and you can use it to service and declog some of your filters, just like a Sawyer filter, which is a screw top. So highly recommend this. And if you want to go above and beyond, you can get a little plastic catheter that you can screw on. It's not the sharp stuff, it's just a plastic little thing, and that increases the pressure of flow. So anything like 16, 18, 20 gauge will shoot a very strong stream of fluids and dilute and remove that debris and bacteria from that wound. And it's so important that you do that, because if you do that, all you need is a little bit of Vaseline and cover that wound and make sure you're cleaning it on a daily basis. Now for burns, you can use something like this. So this is let's see if we can get rid of that glare. There you go. So this is an aloe cane. So aloe, already recommended as an agent to help with burns, but this one also has lidocaine, and it's a 4% lidocaine, which is a decent percentage. So I got this over the counter, and I think it's a really nice mix, because even for bites and stings that are a little itchy and irritating, so we see that that's one of the issues as well with bites and stings, that's an awesome thing to carry. And you can modify this. Just like you can modify steroid creams, which I would recommend if you are the type of person to get a lot of reactions to certain things that you're touching. You can modify that steroid cream, which is over the counter, hydrocortisone, and this one for allergy related stuff, by just having those little allergy capsules, and you can mix it into that ointment, that gel, and that antihistamine, that anti-allergy component helps with that rash. So that's an important trick to know and to have. Now, what did I use instead of Band-Aids? There's three options actually that I do recommend. Number one, I have non-stretchy tape. So this is from 3M, really grippy. It's kind of like hockey tape, but wider. So I like using this for bandages and things that I want to wrap that doesn't stretch. So I use this, and one of the things that I use even more frequently than that, and that's one of the reasons why I have it in my chest rig, and this is one of the things that we actually used out there twice for two different reasons, is athletic tape. So this is, I think, KT tape, and this is just a little bit off of a large roll, and it's stretchy tape. So it's a little more adherent than your average bandage. And the reason why I like it is because rolling your ankle is pretty common, especially in the area that we were in. So if you know how to tape your ankle, a combination of this and that before you roll your ankle, because you know that, hey, this situation's kind of an ankle sprain disaster location, plus you have a history of that, I would wrap your ankle knowing that you're going to go hunting, that you know you're going to go camping. That way, that ankle actually feels so much stronger than your normal ankle, which allowed me to kind of hunt and pursue with confidence in the bush. So I like both of those bandages. The third one that I talked about is duct tape or gorilla tape or marine tape. So gorilla tape, marine tape, those are the two tapes that I like. They're petroleum based, very strong adhesive. You can use it for gear repair. You can use it for blister control with your hot spots, because it glides on your boot. So you're basically putting it on the skin, and that skin doesn't touch whatever hot spot that it's rubbing on in your boot, and that's helpful. And you can light fires with it because it's petroleum based. So an ounce of protection, 100% Gen X Gemini. So that's super important. So what kind of medications do I have? Because another thing that we're worried about is strains, sprains, muscle spasms, cramps, sciatica. If you guys are in North Carolina at the end of the month, we have one spot open for our retreat, and I'm going to show you how to treat a lot of these spasms, strains, and sciatica with just your hands. So if you're interested in that, just comment, and I'll get you that that info as soon as possible. So for those, Tylenol and ibuprofen, very simple medications, very accessible. The one thing that oftentimes are kind of looked upon or missed is the actual dose and frequency. So I think 60% or 70% of all the discharge summaries has the doses of the Tylenol ibuprofen, because for the majority of the pain discomfort for someone who doesn't have heart issues, who doesn't have ulcers or acid reflux issues that are severe, that's the combo that I would recommend. Now for Tylenol, one of the questions I get asked is, can I use Tylenol and ibuprofen at the same time? Yes, you can. And the reason why I like using both of them is because they work in different ways. Tylenol, good for pain, good for fevers, and can cross the blood brain barrier. So typically, when you have pain, your pain medicine acts on that area of pain. But if you have a high enough dose of Tylenol, it can go through that brain barrier and kind of talk to your brain to say, like, hey, it's not that painful. So Tylenol, for that reason, is a good medication at that dose. And the dose for it is, if you're having 650 milligram pills, one every 6 to 8 hours. But if you have the 500 milligram pills, which are extra strength, I would say that you, and typically we do this if you're in a lot of pain. We do this for our pregnant patients. It's 1,000 milligrams, so 2 extra strength Tylenols every 6 to 8 hours. So that'll put you in that safe range of not having too much to affect your liver. And then ibuprofen, this is great for inflammation, joint muscle sprains and strains. And in addition to that, both of them help with fevers. So if you're able to, if you don't have heart issues, if you don't have acid reflux issues, if you don't have bleeding issues, this is a good option. And the dose for this is typically 600 milligrams every 6 to 8 hours. And in addition to that, some people use 800 milligrams less frequently, so every 8 hours. And when we think about the timing frequency of it, both are pretty much every 6 to 8 hours. You can either take them together every 6 hours, or if you are in a lot of pain and you see yourself reaching for something or needing something every 3 hours or around that time, you can alternate between the two. And that's what we typically do for kiddos as well when they're having fevers and sicknesses. We alternate. And if you alternate, you can have one or the other every 3 hours. So, what other medications that we got prescribed from Duration Health or the other companies, Jace Medical, things that help definitely is nausea. So, if you have something that really combats nausea, I have Odancitron, also called Zofran. That's 4 milligrams, and you can take it every 8 hours or so. And that is a good medication to help you on your flight over, your boat ride over. That's one of the medications that besides the pain medications, that I use most frequently. And in regards to antibiotics, I have doxycycline over here that can be used for pneumonias. It can be used for skin issues. It can be used for severe skin issues that have concerns for MRSA. So that's a resistant bacteria. And in addition to that, tick bites. So tick bites, especially in Maine, I'm seeing that the guidelines, typically you want to give a prophylactic or a preventative dose of antibiotics for a tick bite that has been latched for more than 36 hours. But to be quite honest, I've seen Lyme disease develop with less than that. So people coming in and it's been latched on for the afternoon, well less than 24 hours, and they're still getting the rash, they're still getting Lyme disease. So that's why I brought it, because you just take 200 milligrams, so 2 of these once after you remove that tick, and you're good for the rest of your hunt. You have some peace of mind. So that's why I brought that one. And I do have amoxicillin clavulanate. So that's a mixture of a penicillin. And that's typically good for pneumonias and gut issues. And that was mainly for kind of pneumonias, gut issues, and to make sure that on our way back, because we're processing all the meat in Alaska, basically off the truck bed. So I wanted to make sure that process, we weren't getting sick as well. And because we were on a little smidge of altitude, and I didn't know how my uncle would react, how I would react, because I suck at high altitude. It takes me like at least a week to adjust to high altitude, even if it's in Denver or something like that. So I have some steroids over here. There are other medications that would be recommended as well. but knowing that my uncle has kind of borderline asthma, that he has a history of allergies, steroids was something that I considered bringing. And these are all prescriptions that were given by Jace and Duration Health. So those are the main antibiotics that I brought. Sure, you can bring a whole bunch of other medications, especially if you think that you're going to be operating in a very hot, murky, water infested area, because the bacterias in seawater and fresh water are different. You can consider bringing additional antibiotics for that. Now, another thing that I did bring is bandages like this. So the reason why I brought bandages like this is because you can use it for splinting, you can use it for wounds, you can use it to wrap your knees that are getting swollen because you twisted it. So these are multi-use, and you can improvise pressure bandages. And I also brought this little magnet to keep my needles safe. And this is mostly for gear repair, not necessarily used for sutures in the field, which I do not recommend for the majority of the cases. And in this boo-boo kind of side, one of the things that is very, very common, almost, I would say day 1, day 2, that will give you issues is hydration, muscle cramps. So I always bring rehydration salts. So I have one in my main kit. I have one on my person. I have some in my bag. That's how much stock I put into that, because in these activities, you're having fun, you're chasing things, you're doing work, and you're losing a bunch of electrolytes, and you don't want to be suboptimal, cramping, or having any heart issues because you are in such a deficit from sweating or dehydration. And because my uncle has allergies, I have both diphenhydramine. So that helps with allergies. It can make you a little sleepy. He has some sleep issues as well. So I have some sleep issues as well. So that can help with sleeping. And then very important, diarrhea stuff. So Pepto's a good one. Loperamide is also, this is Imodium. So that's a good one to have. So I hope this is helpful for you guys. Let me know what's in your first aid kit. Is there something that you keep in your boo-boo kit that isn't over here? Because that's kind of the majority of the boo-boo stuff. And I just have some moleskin over here. So that's the boo-boo side. So before we move on, let me know what questions you have. And sleep. Yeah. Who has sleep when they're hunting? It's definitely an exciting time for sure. And let me zip up this side, and then I'll show you the one thing that kind of crosses base between my main kit and my on-person kit, because emergencies do happen, and it would be such a shame to go on a trip like this, a once-in-a-lifetime trip like this, and have to call that evacuation because something really bad happened, and not knowing what to do and not having what you need to intervene when you know that helicopter, that float plane is going to take hours to get you. That's a scary thought for sure. And I would say for the pain stuff, I did also bring some aspirin just for that situation. You know, someone who's elderly, and even myself, I'm like in my 30s. If I had chest pain and I thought it wasn't related to my eating and I was having some trouble breathing, I would pop 324, 325 milligrams of aspirin, chew that, and call that ambulance. Now, check out the trauma side of this. So let's see if I can hold it up in one shot. So bleeding, very, very important. So we'll talk about some of the bleeding stuff we have here. Some airway, basically the whole marched algorithm. And I do include the ED in my March algorithm, the exposure and debility. So for those of you who want to learn more about that, check out the link right on the screen right there. So for bleeding, I love this combination. So check this out. Besides the tourniquet, a pressure bandage. So this is an Israeli, plus a SWAT tee. Super, super helpful. SWAT tees are basically this rubber band material, and you can use this as a pressure bandage and a tourniquet. So the main difference is, are you stopping a pulse in addition to the bleed? If you're stopping the pulse, it becomes a tourniquet. If you're just stopping the bleed, it's a pressure bandage. And you can put a bunch of material. So let's say if you don't have any extra stuff, This is the only thing in your kit because it's so low profile. I like carrying this when I'm just walking about, going to a party, going out on the city because of how low profile this is. And let's say you don't have a lot of material, you can ball up a t-shirt, you can cut material, put it on that wound, and then put this on top of that, and that will make a really, really good pressure bandage. Now, the Israeli bandage also really nice one to have. It does take a little more space. So this and the SWAT tee and a tourniquet is typically on my chest rig. So that's on my person when I'm hunting, or if you are hiking or something like that. First thing on your first aid kit on your bag. Now, other things that I have is similar to a SWAT tee, but it's super wide. So look how wide this is compared to the SWAT tee. So it is just under double the size, and this is a lot of material too. Look how thick that is too. So this is 9 feet long. I don't know how long the SWAT tee is, but this is definitely really long. So the wider it is, the more compression surface area is able to push on the blood vessels, onto the muscles, on the tissues, and stop that bleed. So this is in my main kit. And for other bleeding stuff, I have hemostatic agents. So I have Quick Clot, I have Silox, I have packing gauze. So this is vacuum sealed packing gauze. So I would include all of that in your main kit for bleeding. In addition to that, what else do I have for bleeding? I have another Israeli in here. So I have 2 of each pretty much when I travel. And when we're thinking about airway issues, I do have an albuterol inhaler that's in my Jace kit. I'll show you right here. Jace, one of the things that I like about this is not only does it supply antibiotics and prescription medications, it provides your prescription medications. So if you are someone with any kind of chronic disease, this company will give you like 6 months supply. And that's a big plus. If you live in the middle of nowhere, if you don't want to have the hassle of refilling your medications or running out of your medications, this is a great company to work with. So as long as you have a prescription from a doctor, they'll refill it. And the other thing is they're very generous with their prescription amount. So like some of these are almost full of medications, which I really appreciate. And I got my albuterol inhaler over here, just in case people had a cold or allergy related breathing issue. So I had that. Now for airway issues, another thing, and breathing issues, this would be like the worst case scenario because we did see a grizzly there. More footage to come if you're excited to see what Alaska looks like and what grizzly bears are scared of. Let me know in the comments, because the worst case scenario is we get on a location, we make that successful kill, and we get surprised by a predator. We had wolves out there, we had grizzly bears out there, and they puncture a lung, or they hit you, they just slap you so hard, which the slap force of a bear is incredible, and it punctures a lung. The only way to kind of remedy that is I'm either putting a finger in that person's chest or putting a needle. So this is specifically designed for treating collapsed lungs with specific training. So I get this from North American Rescue. I have 2 of them. Thank God we didn't have to do that because that is a very bad situation. Same thing for sucking chest wounds. I do have chest seals that are on my person, on my chest rig, and they're basically like a very occlusive tape with a valve that prevents air from going inside your chest wall. So definitely recommend that on your person or accessible in your day pack. I included scalpels, and I have rounded scalpels like this one, and I have pokey scalpels like this one. The rounded ones are 15 blades if you're looking to buy any of those. The pointy ones are 11 blades. Those are the ones that I typically use to puncture abscesses with. The curved ones I typically use to make slices and incisions with. Why did I bring it? Mainly to process the hide, because when you're getting the face off of an animal, these small little scalpels are really helpful. So fingers crossed, and it didn't happen that we needed this for any other medical issue, but I brought it mainly for hide reasons. And Another thing that we mentioned in kind of the boo-boo section was kind of bites and stings. So I did bring tweezers. A good set of tweezers is always really helpful. Whether that's to poke hairs off your face or to take off ticks or to take off splinters is really helpful. And instead of getting kind of antiseptic wipes or anything like that, I just have plain old iodine. So this is Povip. I can't pronounce that. Povidone iodide or iodine. And basically, you can dilute this to make antiseptic wash. It's very simple. So you're not doing a whole lot of calculations, 50-50. So 50% this, 50% water. And I'm able to draw it up in that big old syringe. Do a pressure wash if it was a really, really disgusting wound. So if it was like a gut shot and then you had a cut that a lot of the stool went into, or if you're in a swamp and you're walking through that and you got a really bad and deep cut, I would still wash it with water, but I would also include that because that is a very dirty wound that has a high likelihood of infection. And if you're not flying out for another week or so, it's a good idea to disinfect. And you can also disinfect your tools with that. So it is one of the things that I bring. You can make a Dakin solution with bleach and a few other materials, but this is so simple. You just buy it off the shelf and then bring it. And you can wash your tools with it too. I do have some medical gloves and I do have some antibiotic ointment. So mainly, the main reason I use antibiotic ointment is so that the bandages doesn't stick to the wound if you don't have a non-adhesive bandage, because those are typically more expensive. You can use either Vaseline or that. And one of the things that I did bring that I would say would be trip enders or things that would cause the trip to be very uncomfortable are things that help with your eyes and ears, because ear infections, they suck. They hurt like heck. Same thing for anything to do with the eyes. So with that, with this big syringe, there are little things that attach to it that can help with eye washes. They look like cups, but you can improvise one so that it doesn't squirt all over. But if you just need to rinse your eye off with clean water, so boiled and cooled or filtered, that works really well. But I have just lubricant for your eyes, so artificial tears. For the majority of the things, I would keep this in your kit because if it's an infection, I would still alternate with the ointment or the eye drops and this, because the faster or the more lubricated and moist your eyes is, the faster it heals. So especially for abrasions, all of you should be wearing some protective eyewear. But if it scratches, it'll need some moisture to heal. And I also have some medications that numb the eyes, because that can give you some relief as you're trying to figure out what's going on. And I have some drops. So I have some antibiotic eye drops, and technically you can use it for your eardrops, but I would not use the eardrops for your eyes. So the antibiotic eye drops was something that was prescribed that you can request from Duration Health or Jace Medical. And for our Canadians, Jace Medical. Easy. So as we're going down the algorithm of things to bring in your kind of trauma and emergency stuff, we talked about bleeding, we talked about airway, we talked about breathing issues. And next would be kind of like circulation issues. So what do you have for circulation issues? You're thinking CPR type of stuff. So aspirin is something that I would bring in the medication list, and knowing how to do CPR. That's one simple thing that no matter if you go way in the middle of nowhere or if you're just walking down the street, that is a life-saving skill. And you can literally join our group and learn how to do it pretty much right now. So really important skill, but after that is hypothermia. And I want to take a little bit of time to talk about hypothermia here related to equipment, because this is some of the equipment that I brought. And there's another thing that I'm going to show you right now that I think is just so versatile and something that I would from now on pretty much always bring. So number one is a Malar tarp. So there are different versions of the Malar tarp. The one that I sometimes bring or oftentimes bring has almost like a tarp-like material on one side and then a reflective material on one side. That's pretty heavy. So I tried to go between something like that and something like the first aid ones that are really lightweight, but really shitty, to be honest. It rips really easy. If you have a bunch of them, sure, some redundancy there, but it rips really easy. This one has almost like a painted durable side, so the green side, so it doesn't rip as easy. It almost gives some stretchiness to it. So I have that, but you combine that with this. Check this out. There you go. So one of my favorite buys for this was on the left, the poncho. So this is I think it's the USSC or something like that on Amazon, but I can put the links in the description. That poncho modeled off of the US Army, and I believe the Canadian had a model that was pretty similar. Poncho. The only difference is it's lighter, which if it's lighter, it had to drop in durability. But I found that the durability for this model, it still ripstop material, and it was able to cover all my equipment. I was able to put up different configurations of shelters really, really quickly. And for those storms that roll in Alaska, in the mountains, that just like happen like that, it was so nice to keep my rifle, my gear, myself dry at a whim. You know, like it took a few seconds for me to just pop it over everything. And one of the things that I had, because you can only fly out there in our location with a limited amount of gear, and for those ultra light hikers, this you'll like this too. You can use it as a dry bag, whether it's over your whole self and over your bag, or what I do, and you can drop weight even further by incorporating a bungee like this. So this bungee, you put the poncho over your bag and you just put that bungee around so it kind of wraps around it. Or you can just have like a little bit of bungee. So like maybe this amount and then your paracord. So the paracord's lighter than this, and you just have a stretchy bit that can go over and give it some give to wrap around. And I actually recommend, for those of you who want to be really darn prepared for the fastest, most reusable tarp configuration setup that doesn't damage your equipment. So this is something that I want to keep for a few years, because I like buying my equipment once and treating it well and maintaining it well. And one of the things that you can do when you're doing your ridge lines, when you're doing your quick deploy ridge lines, is incorporating some bungee in those knots. So any kind of point where your tarp or your poncho attaches to a string under tension, I would put a little bit of a bungee in that, and I would pre-do it. So if you have strong winds, if you have something like that, it has some give versus a static line that can pull the rivets off of your tarp, which happened on our kind of kitchen tarp, because I didn't want to cut my gear to do that on a cheap tarp. But that's a quick tip for you for that. And moving on, other things that I would keep. Here's my duct tape. This is Gorilla Tape, and this is a Wazoo fire card. So really, really good. I have the links to my EDC stuff in the descriptions, but both good for gear repair, bandages, hot spots for blisters, and fire. And when we think about other things that we're kind of treating, fractures. So I have this extra long 36-inch SAM splint, and you can also use it. I have a wider one that I keep in my backpack. See? Wider that I keep in my backpack, because when you're using kind of jet boils and stuff like that, you can put this around it and block the wind. So multifunctional. I used it as a sit pad out there to keep my butt off the wet, cold ground. Kneeing pad as well. You can waft coals into flame with this. And in addition to that, I know it shows how to splint feet and wrists and arms, but you can use that as a neck brace as well. So keep that in mind. This is very versatile for your fractures too. And then, of course, in any kind of stop the bleed kit, you got your tourniquet. I like SAM XTs because it gives you an audible click when it is tight enough, which is typically one of the most common mistakes when applying a tourniquet. So that's a nice little bit. And because I was trying to cut on weight, I didn't bring my whole stethoscope. I didn't bring all that, especially if you don't know how to use it or how to take a blood pressure and that type of thing. Not really helpful if you don't know how to use it. But quite simply, I have this pulse ox over here, and this is pretty light. It's pretty small as well, and it does heart rate and also oxygenation, especially when we're at that altitude, or if you're having someone who you think might have like a breathing issue or a heart attack or something like that. Good to know what their oxygenation is too. All right, so that's kind of like the main kit. I have a kit explosion on my desk, but let me show you what's on my chest rig because that's your individual stuff. This is what I would take on day hikes and pretty much in your backpack if you're going away from base camp. So chest rig over here, number one, signaling and safety. So things that you should typically have on you at all times. So for safety, I have my bear spray, I had my rifle, we had a shotgun, so that's some safety stuff. This Wazoo fire necklace is one of the things that I wear the most often in the bush, and I attach this storm whistle. So storm whistles are this is a Fox 40 whistle. There are different types of storm whistles, but make sure you get a storm whistle because it can whistle when wet. It can whistle really loud. So that's a nice signaling device. And the reason why I like the Spark necklace isn't it's the design is nice, but the utility is just awesome. You have that little ferro rod here, and is that enough to create a fire? Yes, with the right skills. So if you want to learn how to do that type of stuff, check our stuff out. And the other thing is this little guitar pick looking thing is ceramic. So a lot of like fire starter things use metal. Ceramic is harder than that. So what does that mean? It is not a sharp surface, it's a 90-degree, but it can cut. So if I need to cut material really quickly, if I need to use it for my ferro rod, it's a really good tool and it won't hurt me, like it won't cut me and it won't corrode, which is also a really good point as well. So highly recommend that on your person. Other things on my person is have a good set of trauma shears because let's say if you are going bare bones on your first aid kit, your bleeding kit, and you're only bringing something like this, if you're trying to make things, make materials, make tourniquets, a set of good trauma shears makes it all the faster. And time is brain, time is heart, time is life. So if you were trying to stop the bleeding, if you're trying to splint fractures and that type of thing, getting to where you need to go, identifying things and making materials is super important. And one of the reasons why I like these X shears and this company, like they're awesome people to work with as well, but their product, it speaks for itself. Like the thickness of this shear is just outstanding. And the metal itself, it's high carbon. And I can use this as a survival kind of cutting edge, no problem. And the way that it's shaped kind of bevels up like this, it curves up like this. It's just very easy to go in and safely cut material away without stabbing, hurting, or risking injuring your patient. So I have this on my chest rig and I use it to cut things more than I used my pocket knife. So I love that. And Eberly Stock just makes such an awesome chest rig too. So check them out too, because they have an awesome day pack that I used and also a bino harness. And I'm not sponsored by them. I just like love their stuff. So the bino harness, again, you can say like the bino's a little bit for safety because we actually used it to scout out the grizzly bear that was very close to us. And I have kind of my eye protection under here. So just over here. And my little first aid kit is right over here. So again, stop the bleed stuff. I have my tourniquet over here. I have some kind of ace bandages I can use for kind of twisted ankles, twisted knees. Again, this is kind of what I use the most because I use it for bandages and wrapping my ankle. Airway stuff. This goes in your nose. It's called the nasal pharyngeal airway. I have this with some lube over here that can help kind of open things up if you have sleep apnea, if you have your airway kind of not receiving a whole lot of oxygen when you're passed out. You can do some maneuvers, but you can also do that to help your airway. Again, I have my second SAM XT here with some gloves and some packing gauze, hemostatic agent. This is Celox. And I have more stop the bleed stuff. So Cheetah Sam, also really useful, and chest seals. So that's kind of what I have on my chest rig in addition to signaling devices. And if you guys are just having fun in the middle of nowhere and you don't have like an emergency signaler, please get one because it is literally something that will save your life. Out of all those things, like this is a definitive way to help save your life. So get one of those. So that's what I keep on my chest rig. Another request that I had from you guys is how do I keep warm in regards to like fire related stuff? So I have this modified fire fast. So this is a huge chunk of magnesium. Magnesium burns at like thousands of degrees. So a combination of that plus a nice thick ferro rod can keep you safe if you know how to make a fire in wet conditions, which me and my students know how to do. And in addition to that, another question that I had is what's on my Leatherman, because I mentioned that it had some medical tools over here. So I basically have 2 edges that I custom made with a Forge and Fire buddy of mine. So see this pointing one? So that is the blade that mimics an 11 blade. So my pointy one. So if I have to sterilize that with some betadine and stab open an abscess because it is getting more and more infected, I can do so. And then I have one that is a little more rounded. Let me pull it out. I think it's on the other side. Here you go. So instead of a kind of can opener, this one is rounded. So that mimics my 15 blade. And I actually use that on a loan to make spoons. So it is kind of a spoon knife as well. And it's a single bevel. So it's a kind of like a chisel grind, a curved chisel grind. So it's very easy to sharpen as well. So that is the majority of the first aid items. So we talked a little bit about the emergency stuff. Let's talk a little bit about the boo-boo stuff because dehydration's huge issues. I think allergies and rashes, especially if you're known to have them, is another thing. So we talked about steroid creams. We talked about antihistamines or allergy medications. Try to get the ones that are non-drowsy. Those are a little bit more helpful and doesn't cause you to be dreary unless you have trouble sleeping and you can use it for both. Bites and stings, remove the stinger, kind of wash the area, and you can use some antihistamines as well. And for nausea, vomiting, and upset stomach, that's the tagline for Pepto. So if you don't have Pepto in your kit, try to use some of that. So that is the majority of what I want to talk about. This is what my summer day kit looks like. The main difference over here is I have a signaling card. That's also from, I believe, Wazoo. And in addition to that, there's a solar kind of magnifying glass. You can make fires with that as well. And some survival cards that are useful. You see my Sawyer filter right in the middle. It's kind of that blue tube thing. And the one big thing that changes for hot environments is I have this cloth that absorbs a ton of water and it cools really quickly. So I use that quite often when I'm doing hot environments. Now, for those of you who are sticking here, like I have some extra special things that I wanted to share with you because these are the things that made my trip like that much better. So I'm glad that you guys are still here and hanging out because this was one of the things that I wanted to try that I haven't really brought on any adventure with me yet, but I think it's going to be in my pack almost every single time I go to above freezing environment. So this looks like a bandana, but it is a bandana / net. And this is from Wazoo. It has some identifiable medicinal and edible plants. And I think that's a mushroom as well over here. But some of these plants are very, very easy to identify. So that's useful. But I like the fact that they stayed true to the material, because having kind of a cotton material, it's really comfortable on the face. So I used it mainly to wash my face. But once you're hunting and processing meat, there's just so many black flies that come out and your face and neck gets wrecked. So having this net on with a cap was a godsend. And in addition to that, since one side is kind of not transparent like the net, on those hot and buggy days, you can kind of alter it to get some shade on your face so you're not getting burnt, which was really, really useful. So I love this, and I'll be using this really, really often. In my main kit, I had a triangle bandage, but if it's cold enough or if you want to bring kind of a shamag, that works really well too. You can make material out of this. You can use it as a pillow. You can use it to primitively filter your water or pre-filter your water, and you can make char cloth out of it. You can do a lot of things with a shamag. So I carry that typically as well. Headlamp was another luxury that I had. So rechargeable one. This is the one that I use on Alone, actually, the same model. And it has these batteries that you can just charge directly with your power bank. So I really like that. So that's why I bought that one. And one thing that I will do every time I hunt from now on is bring these. So these are just regular heavy duty dish gloves. And it was so much easier to kind of process the hide off of the meat because you can bluntly dissect things with your fists and knuckles instead of using your hands, getting all grimy and stuff. And in addition to that, it kept your stuff clean, and yeah, it allowed me to still maintain dexterity, keep everything clean, and then very reusable. I just used some camp soap and water, and this is after being filled with feces and blood and all sorts of grossness. And the last thing, one thing that I appreciated out there was this. This is kind of like an army issued that I got at a military surplus camouflage net. So great for mosquitoes, kind of wraps the whole body. The reason why I brought this is because I didn't want to bring a camp chair. So you can make an improvised hammock out of this. You can make improvised camp chair out of this. You can use it for camouflage. You can use it to keep the bugs off of you. You can use it as a scarf if you need additional warmth. So very multi-use. So really like this one. So try it, see what you think. I think that is all the things that I have. That's kind of like my setup over there, my Tika T3X and Jace Medical. So my last statement for you guys, if you are looking to get antibiotics, if you're looking to get prescription drugs, you're Canadian, check out Jace Medical. I'll put the links below. If you are looking for adventure medical supplies, you can also go with Jace. You can also go with Duration Health. Both are awesome companies to work with. Yeah, prescription medications, Jace. And if you are looking to learn this stuff so you know how to use it, check out our program at survivenow.online/lifeline. Thank you guys for hanging out. I'm going to answer some questions, so feel free to just chime in. I know a bunch of you are still here. So yeah, let's go into a Q&A session. All right. Would you recommend for someone allergic to, or what would you recommend for someone who's allergic to penicillin and codeine? So number one, like it is rare unless you have fractures and severe injuries that you need something like an opiate class. You'll be surprised the amount of pain relief, or at least notching it down so that you can function, that Tylenol, ibuprofen at that correct dose would do for you. So for pain, I would still stick to that. I wouldn't necessarily recommend or ask your doctor to prescribe you any pain medications other than that. You can also use Aleve. So Aleve is naproxen, 500 milligrams twice a day with food. Can also be helpful with your pain, and it's less frequent. So if it upset your stomach, it's not as frequent. And allergic to penicillins, there's a lot of different medications that you can use if we were thinking about specific type of infections. So to give you an example, for mouth infections or like dental infections that we get really often, clindamycin's an option for you. For skin infections, for pneumonias, doxycycline's a good alternative for you as well. Awesome. Nina, thank you for bringing this up, because super glue for cuts, I would say, okay, not the best, but for very superficial cuts. So superficial, think paper cuts. Anything that's past the skin and deeper and long, I would not recommend. There are toxins in that super glue that slows down your healing. And if you are sealing in the infection, that could cause an abscess and cause a whole lot more issues for you. So super glue, sure, keep your wound super clean. and then consider it for like paper cut styles, I would recommend using surgical glue or medical grade glue because that's less toxic to your skin and made for that. But you'll find that even medical glue, sometimes it's not as robust as just cleaning it properly, putting some topical antibiotic or Vaseline or salve on top of your wound, and putting a bandage on top of it, and having that just heal and scab over. That way, you can check your wound twice a day, every day, wash it, and do that. Your first aid kit or my first aid kit, so your first aid kit has many things that can also be used for pets, including electrolytes, emergency antibiotics, and aspirins. So I would talk to your veterinarian about some of these medications because some of these medications, if even like antibiotics, the formulations can be a little bit different and a little more stressful on pets' kidneys and livers and that type of thing. So I would definitely consult your veterinarian or veterinarian friend who will kind of keep it real with you. Definitely electrolytes are good. All right, bicycle inner lining. So I imagine you talked about this or brought this up when we were talking about fire related stuff. If you have a bike that you're changing out the tire and you have that inner tubing, save it, keep it, especially if that tire is not working, and that inner tubing, like you're going to replace it anyways, because all of that's petroleum based, it's rubber, it will burn. And it's actually very similar to these, they call it Ranger bands. I use it to organize my equipment because at the end of the day, I like kind of aftermarket first aid cases, like things that I think just do the job better and are lightweight. So this is a Van Quest kind of organizer pouch. It's not even marketed as a first aid kit pouch. It has this like mesh thing over here that's transparent, so you kind of see what's going on. And you see that there's zippers kind of all around over here, so you can make it really, really small like that, or you can bulge it up like that and carry a decent amount of stuff. They have different sizes. So if you combine that with an organizer band, like a Ranger band, like that, so you can have like all your stop the bleed stuff in like little sections. So you're like pulling things out in sections and in organized sections. That is a really nice way to do it. And it doesn't have to be like a really robust kit that is bomb proof because at the end of the day, the majority of the time it's inside your backpack. So I like those lighter ones too. Personal medications are key. Yes, have enough of your medications. And if you need prescription ones, check out Chase. Any Sasquatches? No Sasquatches. We saw grizzlies. We saw two dark wolves and one white wolf, which was pretty cool on our first kill. Yeah. So, what are bears afraid of? We were shooting content on a hiking day. So this is a day that we couldn't really hunt. So I had luckily my filming stuff with me. And as we got to a ridge line, there was a grizzly, a big old grizzly that was like dark on the top and really blonde on the bottom. It kind of looked like it was wearing pants. And we get to this ridge line, and it's so hard to walk in the tundra. It literally took us an hour and 40 minutes to walk like literal over a mile. And we get on a ridge line, and I'm pointing at a direction where the wind's blowing in my face. So I'm hoping the herd just like runs in front of us. And Larry's out in our back, and he looks out and he's like, a grizzly's coming. And it's like less than a mile out. So we had options to kind of take our sweaty clothes off and waft it in the wind. Hopefully that was enough to scare it, but it wasn't budging. It was still walking towards us. And our hunting guide said, like, oh yeah, grizzlies are terrified of drones. So I had my drone up and I was just filming footage, and it just ran. It didn't even get super close, but it just ran into the bush. I think it kind of mimics an angry hornet's nest or something like that, but it was a good way to scare it off without using a gun, without using pepper spray, and using it at a distance so they're not even getting close to you. Oh, thank you. I am a little bit of a MacGyver, and I appreciate the comment. Ooh, Dollar Tree challenge. Who's up for that? Let me know in the comments. Get a first aid kit with, I don't know, what budget amount should we kind of budget for a first aid kit? Give you an example for adventure medical kits, which is I like it for the organizational pouches, but I literally took out like 70%, 60 to 70% of everything in there to put my own stuff in. But yeah, they're about, I think, $40. So I think we can do a lot better than that. So that challenge would be really fun. Okay, great question. Do you use any herbal medicines when in the bush? And if so, could you tell us and how it helps? So there are a lot of natural things that can help you for survival situations. Number one, clean water. Natural, right? But using the correct way, it can help a lot with wound care. So if you see these shows where they are in the wilderness, they cut themselves and they're afraid that they're going to die of sepsis, which is like so far down the line. Clean your wound properly with clean water. So if you have to boil it and wait, do that. If the bleeding stopped, your main objective is to stop the bleeding first. But if the bleeding stopped, clean your wound well and literally use parts of your t-shirt. You can boil parts of your t-shirt so it's clean or semi-sterile and then change that bandage. That's super helpful. In addition to that, when we're thinking about plant related stuff, certain plants have different pHs. So if you haven't checked out our wound talk on YouTube, check it out. It's one of my longer live videos. So check it out. We talk about a bunch of different little plant related stuff. Plants that have a different pH, like an acidic pH, that could be something that wards off a lot of infection, a lot of bacteria, because bacteria, just like our bodies, operate at a certain acidity. So if it's too acidic because you're using a soaked water from reindeer moss and it becomes like a pH of 4 or 5, and it doesn't really grow a lot of bacteria, then that's a good option. In addition to that, constipation's a huge kind of consideration out there. Make sure you are eating things with fiber. So that can be like a medicinal thing instead of taking like a laxative. Increasing your water and fiber intake would solve the majority of your constipation issues in the bush. Now, when we think about like bringing stuff that are medicinal, like traditionally medicinal, what would I bring? Salves. So there are many different medicinal plants that are put into salves that are helpful. Whether I believe that the antimicrobial effects are similar to something like bacitracin or an antibiotic, I'm not quite convinced because there's not a whole lot of research with head-to-head studies. But for wound healing, there's not a whole lot of difference between these different cells. So if I just use Vaseline, that creates a nice moist barrier for your wound to heal, and you're washing it twice a day with soap and water, or just like clean water under pressure, the healing times are quite similar. So a salve would be just fine. Ooh, hammock or tent. So I am going to be forced to hammock camp uh, at the end of the month because I am renting one of my tents to one of my students. But I do prefer a tent just because I like my equipment kind of in arm's reach. So if a bear comes, arm's reach, instead of like kind of wrapped in in a hammock. For lounging on a beach or something like that, sure, hammock. For long term, definitely a tent. I like the space mostly. Ooh, another homeopathic question. Um, are we doing anything with homeopathic, herbal, naturopathic items? So, like I mentioned, mostly salves for me. There are medication that helps with nausea that you might take, like it can be as simple as ginger. So ginger is a great thing to have for upset stomach. Um, you can have things that elevate your vitamin C. You can have things that are like food related, things that are kind of where two paths is between medicinal and herbal medications. Can be as simple as salt, you know. So salt for rehydration. So for specific naturopathic like tinctures and that type of thing, I don't typically bring that because of the weight, because of the effectiveness. They're like I don't think I would switch an antibiotic with any kind of tincture at this point, unless I see evidence. If I see evidence, then sure. But at the same time, it's not regulated, so you never know what concentration you're getting. Tree challenge, $20. Do I have any seconds for seeing if we can do a really awesome first aid kit for just $20? Let me know. Hydration salts. So check out my talk on dehydration and rehydration. It's like an hour-long talk on YouTube. I talk in depth with that, but the things that I like bringing is liquid IV. I have oral rehydration salts. I think that's like a brand, and just make sure that it has some potassium, some magnesium, some sodium, and some citric or citrate in it. That helps as well. Oh, so if any of you are coming from the Canadian Prepper, it's funny that you mentioned that. So he is well known on YouTube for his toilet paper kind of compacted things, and I actually brought some of those packets from his actual warehouse. I didn't get to use them, but the cool thing about those, I believe they're plant-based, biodegradable, so you can put that in your cat hole and not worry about it affecting the environment too much. But I recently came across dude wipes, and they're really nice. They have like moisturizing stuff in it. I think they have some aloe in it, and they are also plant based as well, and and they break down quicker. Ooh, good question. So, Northern Dad, what's up, brother? Nice to see you on here. It's been a long time. Do I change the contents of my trauma pack based on what I'm carrying, axe versus knife? No, not necessarily, because especially if I'm doing like a wilderness type of adventure, and I know that there's black bears around, which typically in Maine there are black bears. There, and if I'm going to Colorado or anywhere else, typically they have like mountain lions and grizzlies and that type of thing. And if you are like having a kit that you bring with you, like in your car, and you just get into a car accident or you see a car accident and you don't have the right equipment for it, like I would hate to be in that situation. So I would rather carry that extra tiny bit of ounces and that tiny bit of volume to make sure that I'm able to provide that care for that patient and for myself too. But prevention and proper technique and knowledge and skills and practice definitely is paramount in this situation. But I would not necessarily change anything that I brought over here, even though I brought an axe over there, even though I brought like a silky saw over there. I wouldn't change any of the trauma stuff. Nice. So with that, I'm going to wrap up, you guys. Thanks for hanging out. Thanks for engaging. Thanks for all these amazing questions. And let's do a Dollar Tree challenge. $20, it seems like. Awesome. All right. Love you guys. For those of you who want to support, who are learning things, check out our education. We're running a promotion right now. See ya.